Today, I want to talk with you about a topic that concerns each of us, health. But this isn't just about personal wellness. It's a profound, top-down transformation quietly taking place in the United States that could completely alter the way we live and invest. I first became aware of this transformation not at a hearing in Washington, but during a live stream with Dr. Marty Makary. Dr. Makary, a leading cancer surgeon at Johns Hopkins University, has spent the past few years speaking common sense and truth amidst the clamor. Now, the ideas he champions are becoming a powerful policy force. This movement, dubbed Make America Healthy Again, MAHA, by the media and its supporters, stems not from the whims of bureaucrats, but from a growing national crisis that can no longer be ignored. Let's begin with some startling statistics. According to a recent survey from the Centers for Disease Control and Prevention, CDC, over 40% of American children suffer from at least one chronic health condition. Nearly half of American adults suffer from preventable illnesses like type 2 diabetes, high blood pressure, and heart disease. The economic cost is astronomical. By 2025, U.S. healthcare spending is projected to reach a staggering $4.9 trillion, consuming nearly 20% of GDP. We are becoming a nation held hostage by chronic disease, a system that pours vast sums of wealth into treating symptoms rather than addressing the causes. How did America get to this point? The answer may lie at our table. For decades, the American food system has been dominated by a handful of agricultural and food processing giants, whose profits are built on selling us hyper-processed, additive-laden, and nutritionally deficient food. Let's do a simple thought experiment. Imagine walking into a typical American supermarket and picking up a box of brightly colored breakfast cereal or macaroni, beloved by children. You flip to the ingredients list and likely see an unfamiliar name, Yellow 5, also known as lemon yellow. What is this? This isn't a natural coloring extracted from lemons. It originally originated as a byproduct of the petrochemical industry. It has no nutritional value, its sole purpose being to make food look more appetizing. However, numerous studies have linked it to childhood hyperactivity and allergic reactions. In many countries in Europe and Asia, this artificial coloring has long been banned or severely restricted. But in the United States, it remains legally added to hundreds of food products. This is just the tip of the iceberg. Our food is flooded with industrial seed oils, high-fructose corn syrup, and a variety of artificial ingredients. These ingredients are steadily eroding our health and the health of our children. Faced with this escalating public health crisis, a profound food revolution has finally begun. In early 2025, an executive order led by the new Secretary of Health and Human Services, Robert F. Kennedy Jr., officially launched the MAHA campaign. The order's goal was clear: to radically reform America's food supply. The attack is directed at ingredients long debated by the scientific community: industrial seed oils, high-fructose corn syrup, and petroleum-based food dyes. Kennedy bluntly called much of our food system designed poison at the launch. This transformation is rapidly spreading from the federal level downward. Artificial additives like Yellow 5 are being phased out of the American food supply, with completion expected by the end of next year. School lunch programs are being redesigned to replace ultra-processed carbohydrates and mystery meats with whole foods. Tax deductions for gym memberships and healthy spending, once considered fringe ideas, are now becoming part of mainstream policy. The core logic: reward healthy choices and stop paying for preventable disease. This food is medicine revolution is no longer just a slogan. It is fundamentally changing how we think about food. As Dr. Makary, the new FDA commissioner, said, "People forget that the F in FDA stands for food. We are investing heavily in the FDA's role in food regulation." If the food revolution is the MAHA movement's defense, then FDA reform is its offense. The FDA has long been criticized for its cumbersome approval process and rigid bureaucracy. On average, a new drug takes more than 10 years and costs over $2 billion to develop and ultimately approve. For patients battling life-threatening diseases like cancer, Alzheimer's, and ALS, this long wait is a source of despair. Now, under the leadership of Dr. Makary, a profound transformation is underway within the FDA aimed at clearing the clogs and accelerating life. The core weapon of this transformation is not more bureaucracy, but smarter technology, particularly artificial intelligence, AI. Let's look at a few real changes already underway. AI accelerates new drug approvals. In the past, FDA reviewers would spend months or even years manually reviewing hundreds of thousands of pages of clinical trial data. Now, through a program called Real-Time Oncology Review, RTOR, and leveraging AI analysis tools, the review team can process and analyze these massive amounts of data in minutes. Breakthrough therapies like Amgen's leukemia drug Blincyto and Janssen's lung cancer drug Rybrevant have seen their approval times shortened from years to just months, without compromising safety standards. AI empowers drug safety tracking. The FDA's Sentinel initiative now incorporates machine learning capabilities, enabling real-world evidence from the medical records of millions of Americans to be monitored in real time. When cases of myocarditis caused by the COVID-19 vaccine began to emerge, it was the AI pattern recognition technology within the Sentinel system that helped the agency detect the signals within weeks and take swift action, issuing warnings and requiring updates to vaccine labels. In the past, this process could have taken years. AI empowers patients. AI's predictive analytical capabilities are helping regulators expedite the approval of early-stage treatments for patients with diseases like Alzheimer's and ALS. By analyzing massive datasets, AI can identify the patient populations most likely to benefit from new therapies, enabling more precise and personalized treatment. The transformation spearheaded by the MAHA movement has profound and two-way impacts. On the one hand, it will reduce the incidence of chronic diseases at the root causes, significantly reducing the nation's healthcare burden in the long term. On the other hand, a more efficient, pragmatic, and technology-embracing FDA will greatly incentivize innovation in the biotech and pharmaceutical industries, bringing truly life-saving therapies to patients more quickly. This is not just a revolution in public health. It's a profound economic revolution. It is reshaping the value chain across industries, from agriculture and food processing to biotech and artificial intelligence, opening the door to unprecedented and massive growth opportunities for companies that can adapt to this historic transformation and provide truly health-enhancing products and innovative solutions. In the second half, we will transform into professional investment analysts and dig deep into which companies will be the biggest beneficiaries of this MAHA wave, and provide a detailed and actionable treasure map for your investment portfolio.